Okay, we want to welcome everybody to the McDowell County Board of Commissioners monthly meeting. Today is Monday, February 12th, and at this time we would like to ask everyone to please stand. We always begin our meeting with prayer and pledge. Commissioner Green will do our prayer tonight, and Commissioner Ellis will do our pledge.
That's right. Father, we thank you this evening for your many blessings. We thank you for health and strength. We thank you, Father, that you have allowed us all together here this evening. Father, we pray that you give us wisdom and patience to try to conduct the business of this county as you see fit. Help us to always be a light for you in this world. We pray in Jesus' name. Amen.
Amen.
Attention, salute, pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thanks so much. May be seated. At this time, gentlemen, we have the minutes. What's the pleasure of the board? Motion approved. Second. Discussion, all in favor, say aye. Opposed, like sign. We have tonight's agenda before us. That's been posted since Thursday. So what's the pleasure of the board concerning tonight's agenda, and are there any additions or deletions?
Second.
Discussion, all in favor? All right. Move the first item on our appointment schedule. We have Chad Marsh with us. Chad is our Director of Parks and Recreation and is doing an outstanding job. And Chad, we're so glad we've got your information in the packet on the programming and all the good things happening for our kids in the county. So, sir, the floor is yours. Good to have you tonight.
Thank you, Mr. Chairman, members of the board, Madam Clerk, and our county manager. Thanks for the opportunity to come forward this evening. It's always a pleasure to come and update the happenings on in my department. I brought with me this evening, because I never want William, he brings his right and left hand, by the way, with him, and so I brought mine tonight, Mr. Aikman Kazee, in which the many things that you have in front of you we'll go through tonight would not be possible without God's good grace and Mr. Kazee, because he's absolutely been a huge help in helping me carry out the vision and the mission of my department. So, as the chairman already pointed out, in our review, what I tried to give you was just something that encapsulates 2023 as a whole, and without reading every line item, I'm not going to do that because you certainly can do that for yourselves, but what I'm going to say is that as you go, you tabulate the numbers of the different programs that I've presented to you. Last year, there was in excess of 9,000 individual opportunities provided for the citizens of this county to recreate. And so that doesn't include them going out to trails. That doesn't include them individually going to the shooting range. That just says that our programs facilitated 9,000 plus seats for people to come in and do those things. And that's a huge number in our little county, and we're very, very proud to do that. What I will mention to you as we go through here, certainly I'll take any questions that you have, but what I will mention to you are through some of our initiatives, because it is the intent of my department to continue with each one of the programs that we have established. I have no new programs that were planned for this year outside of one that's ongoing now, and that is the addition of our Challenger Basketball League. I want to stop here and just say just how proud of our Challenger Division sports I really am. I can get emotional talking about it. It's just such an incredible opportunity to see young men and women who have never really had an opportunity to participate in a recreation type activity or sport, be able to go out there on the baseball field or go out there on the basketball floor, because they sit in the stands for so many years, some of them, and have cheered on their older brothers or family members, and they just haven't had that opportunity. And we were so thankful to be able to provide that to them this year, and just really looking forward to it going forward. Some of the newer initiatives that we instituted this past year, youth archery, work closely with our vice chair, Commissioner Brown, and we really wanted to go out and try to do something that would enhance some of the different pieces of our shooting range. This was a big success this year. It resulted in our shooting range being highlighted in a national shooting magazine, because there was nothing like it in the Southeast what they're able to do out there for our youth archery events. We've already applied for our NCDOT bicycle helmet grant. That'll be the third year in a row that we've gone after that. We've gotten it 2 years in a row, and so we've been able to work with our county school system and provide needy children with bicycle helmets that allow them to get out and, whether they're riding a skateboard or riding on a bicycle, have something to protect their little heads. We continued on with our Train Up a Child, certainly something, again, there's no other program like this in the entire nation that we're aware of. where we try to not indoctrinate, but we try to teach children about the quality and value of each life and how a firearm is a tool to be used in a safe manner, and we've been very successful there. Let's Get Physical, we continued on with that here again, a partnership with our school system, where we just go out and we don't want, nobody does, not any of us here or anybody in the school system wants a PE teacher to have to go out and buy a pickleball or a baseball or a basketball, and we want our kids to be able to be healthy and happy and be able to recreate, and so we support our gym teachers, and that's been great. This year, out at our shooting range, we instituted a brand new program called It's Never Too Late to Learn. We offered individuals 18 and over the opportunity who did not have any kind of firearms experience to be able to come out to the range and do that. Again, very successful there, and we look forward to continuing that. Our Mountain Glory Challenge 5K foot race was the largest it had been in recent memory. Nobody can show us where we've had in excess of 25, much less than 60 that participated there this year, so we were happy to support the city of Marion and everything that's going on there with the Marion Business Association. And then certainly one of the highlights of the year was opening up our Black Bear Park, and we certainly appreciate all the support from the board and Duke Energy there. Commissioner Green was huge in helping us get that going down there, and even already acted as one of our hosts. We've already seen a number of campers start to come out. It's cold weather, we know that. It's not the ideal time to camp, but we're seeing our reservation requests start to populate, and folks saying they're making plans to come out this year. The staff out there is doing a wonderful job. Mr. Jerry Freeman and Joe Duncan, just fantastic additions to our team. So blessed that they're on board. Your Maple Leaf Accessible Recreation Project, which we were so excited to get moving this year. We're about, I think the county manager can have maybe probably about 2.5 years ahead of schedule on this. So they gave us 3 years, and she's almost complete. And so we're very happy there. If you haven't had a chance to go up and look at it, be working alongside the county manager to come up with a date that works good for the board to be able to propose a ribbon cutting and grand opening there. But it is well ahead of schedule and looking phenomenal. And then that leads me to the last big piece of our year. Was the Rec Center project. As the board is well aware, this is something that's been working since 2021. And I was able to speak to our architect this afternoon before I came over. He already has been given information from 2 prime contractors that they will be bidding the project at a minimum, so we feel like we've got some good traction there. That pre-bid meeting is tomorrow. It'll take place at the Recreation Center at 2:30. We'll be there to support you for a walk around for anybody who's interested in taking a look there at the contractor. And then the bid opening, providing there is 3 contractors, will occur at the Rec Center in the gymnasium at 2:30 on the 27th of this month. The last thing I'd like to mention to the board is another milestone, and I'm so proud to say this, is that presently, with the number of registration that we have received for our Little League program, we're on track again this year to set a record for the 3rd year in a row for the largest Little League in the history of the county. God is absolutely blessed what we've done there. We have 785 plus children already signed up, and that does not count our Challenger division, which we expect a dozen to 2 dozen there, and our senior league, which is the 13 to 16-year-old boys baseball and girls softball, and those are still going to go. The silence and registration is going to go until the high school and middle schools have completed, so that if any young person doesn't make the team, they have somewhere to go and participate and feel part of. So we just. Gentlemen, I couldn't be
where's that, with that number of registers, where does that place us in counties around this?
So we're ahead of them already too, sir. So most of the counties, most of the Little League divisions, we're not going to come out until next month. So we won't really know probably until April, sir, but I can give a number to the county manager at that point and be able to share that with you. But as you know, last year we were 3rd in the state, and we expect that there was some that have already split. Down east, there were some other folks that split, so we expect to be at least 3rd in the state with our numbers again this year.
Chad, elaborate on the partnership between McDowell County and Little League. How is it?
It's unbelievable. Yes, sir. So in 2021, when I took over the Director of Parks and Recreation, I had 308 children participate in baseball and softball and through McDowell County Parks and Recreation. Little League, on the other end of the county, had 325. So when we collaborated, it gave us 633-ish children participate in the program, and we have blown by that 200 plus every single year that we put together the program. This year, we have gone out and revitalized some of our parks. Infield Park down in Glenwood, we actually took a field that had been long since grown over, put in new backstop, new benches, and new bleachers. So now there'll be 3 fields down there. The county manager and I have been talking about some ways to improve parking down there and the like. Same can be said at Lindley Park in Old Fort, where we have gone in there and just totally revitalized each one of those individual fields. And Sandy Andrews was used last year to host our senior league. That had never been done in the history of the county. So everything that we've done, Mr. Chairman, it's not that we're, recreating. It's just that we truly care. We truly want and desire to improve recreational opportunities for folks in the county, but no more so than with our children. Because we know that if we can give them an opportunity to recreate, there's study after study after study, and as a father, like many of you, I don't need a study to tell me it keeps kids out of trouble when they're doing something like golf, and so we're just thrilled to have that opportunity. So, sir, that concludes my report this evening. I'll be happy to answer any questions, please, the board.
Well, I'd just like to say that I really appreciate all you've done. You have lifted this thing up and flew with it since you came on board, and we really appreciate the great job you've done. We love our youth in this county, and we have tried to show that with the work that's been done here, and with our support to you and your staff. And so we want to continue that, and we want it to grow and continue to work. We'd also like to recognize Mr. Kazee tonight. He's been a valuable asset to you, and we appreciate his hard work and dedication as well.
Yes, sir. Thank you, sir.
Any other comments or questions by board members?
If I may, Mr. Chairman, again, Mr. Marsh and Mr. Kazee and his staff are doing a great job, and one of the things that this organization and his department have done is to work towards planning for the next day and the next month and year and so forth. We do have a desire and a need to improve our parks plan. And we had a conversation, as I mentioned to the board, with Foothills Regional Commission, and they are prepared to help us out with that. If you're agreeable, I'd hope to have the cost and all that laid out for you before tonight, but they want to do a little bit more due diligence before they give us a cost proposal. And so we could wait to ask for formal approval of that once we have a dollar amount, or if you'd like to maybe give us some direction to proceed, however you want to do it.
We can approve that to apply without those numbers, can we?
Yes.
Yeah.
I'll make that move that we go ahead and apply for the grant.
Second.
Discussion with the cost brought back to the board, correct?
Yes.
Okay.
We'll do that.
All right. All in favor say aye. Any opposed, like sign?
And that will include initiate the parks plan.
Thank you.
One other question too, Mr. Marsh. I know we had discussion last year. The scoreboard, some of the fields, some weren't working, and there was an issue with, I think, transformer in Old Fort still yet, right?
Yes, sir. Yes, sir. So many of the school boards were dilapidated and just been sun-beaten for many years. We also had some wiring issues leading up to them, and so it really has been costly to go in. The board was very generous in supporting our initiative to go in and replace 3 of them last year, which we did. They're up and running, working fantastically. Presently, all school boards are operating. However, we do have a controller issue with some, and it's only a matter of time before we can continue to have to replace wiring and other things. So, but yes, sir, we'll continue to work on those. And with Duke Energy, they have been very supportive. I have an update for county manager for the board. At Lindley Park, we had some issues that one of the panels that was there that powers both the concession area and the ball field has been insufficient for quite some time. In other words, the draw on the panel is higher than the panel's rated, which is, as we all know, is a very dangerous, potentially a dangerous situation. So we've had to monitor that. And it's one of the things I've conducted since I've been here is safety inspections of all those panels and begin to lock them. But we were able to talk to Duke Energy before I came over. They have been incredibly helpful. They have told us that they're pushing us to the front, and we have a work order with them, and that they could have some action in letting us know what is going to be required as early as end of the week or first part of next week. But it's definitely something that has to be addressed.
Is that something that they're going to pick up the cost, or they're going to advise us what it's going to cost and then let us fix it?
Based on the conversations I've had, sir, it seems to be a hybrid, that there could be some, it does appear that there are some expenses that the county will have to take on, but it also appears that it could be an upgraded service, which typically is handled by the provider by them. So I will provide updates to the county manager, but that's what it looks like right now, sir. It looks like there's going to be some shared expense.
Okay. And cost of the scoreboard, remind the board what the cost is per
So
scoreboard.
last year, sir, including shipping, 3 scoreboards, cost the county just a little under $12,000. And so, again, with those 4, we estimate that to be somewhere between $3,500 and $4,000 to cover the shipping, so there'd be an additional, do quick math, somewhere around 16 or so, 15, somewhere between.
I know as a coach and parent, going to a ball field and the scoreboard's not working, it's pretty frustrating, you know, to keep up with who's winning, who's losing. The coaches and the parents creates a little bit of distraction from the kids being able to enjoy the game.
I think we need to go ahead and get it fixed prior to the season, and I'd like to make a motion to go ahead and spend up to $4,200 not to exceed, and if you can get it done in that way, to go ahead and get that done at Lindley Park.
And we're talking about, which side, sir, are you talking about? You're talking about the power that we're talking about?
How on the scoreboard?
Okay, sir.
Second.
Okay, discussion?
Is that for 4 scoreboards?
No, that's
That's
just
just the
one.
one at Leland Park.
The one at Lindley Park? That's
Yes.
power issue, correct?
It's power and scoreboard, right?
Yeah.
No, sir, no, sir. The individual scoreboards themselves cost approximately $4,000.
And how many is up there at Lindley?
At Lindley, sir, there are 3, but I only need to replace 2, sir. 2 would go to Hemphill Park in Glenwood, 2 would then go to Onufrey. That's where the 4 would go that I need.
Does your new field at Glenwood, Chad, have a scoreboard?
So, no, sir, great question. So the new one that we invigorated is not. However, I do believe that we have saved the scoreboards that we have taken down. And staff believes that based on what we've learned, we can cannibalize and take enough parts from one and create and put the other one back up. So we think we can take one that's existing and move it to the back. That's not going to, it doesn't have lights on that field. So that field is going to have limited play. The other areas that do have lights will get most of the play. And so, you know, that's a whole nother discussion for another day, but that would feel the need.
What I'd like to do.
Does that, okay, go ahead, Tony.
What I'd like to do is, entertain the idea of replacing all 4, or giving you all 4 that you need.
You've got 3 now?
And let's give the county manager a chance to look at the funding on that, and then we'll get back to you on it. How's that sound?
You've got your ARPA interest.
You've got 3 already purchased.
And they're already up, sir. I put them up last year, last year. I tried to do a phased plan.
And there's 1 more left.
I'm hearing you need 4,
I do need 4, sir. I bought 3 last year, put them up.
about $4,000 apiece.
So we're looking at
I would like to retract my motion
Okay.
and get staff to do what Tony was suggesting and going with that because of the cost.
Okay, restate your motion here, Tommy.
Okay, I make a motion that we allow staff to look at the possibilities we have on the funding on this project and move forward with it, contingent with the money being available.
Second.
Okay, discussion, all in favor, say aye.
Aye.
Any opposed, like sign. Okay?
Thank you.
All right, any other comments, questions for Mr. Marsh? There being none, Chad, here again, thanks for all you do. You do a wonderful job, Aikman and the staff, and we're so proud of our strides that you guys have made with the Rex, Parks and Recs. You've done wonderful.
Thanks, sir.
Thanks, sir. Let's go to that next item on our appointment schedule. This is our tax collector items and update. We have Linda Onufrey with us. So Linda, come on up. The floor is yours.
Okay. I'm here tonight to talk about the tax lien advertisement. On February 1st, I provided the report to the board with a total of unpaid taxes for the current year of 2023. This report included county and district taxes. The balance of January 31st was $2,412,646.78. And here is a present the board the list of the unpaid property taxes as of January 31st, 24, in alphabetical order for your review. Your book. So the cost of advertisement, always budget $4,700, and this year the quote was $4,649.40, which is the same as last year. This comes out to about $2.24 per name. And the advertising, if they get advertised, that is added back to the parcel, and so it is collected through that way. I would like to recommend that we do the advertisement on March 19th. They've changed their way they do the advertisement so many days. So March 19th would be the published date, which would be the last day to pay to avoid the newspaper would be February 29th, March 1st. Printer's deadline is March 1st when I send it to the newspaper. I sent out 5,300 notices, which gave them 30 days to pay it per statute for advertisement. And that is it for the advertisement.
Mr. Chairman, I move that we accept the list as presented and also approve the placement of the list in the paper for advertising.
So,
Discussion?
On this, just for clarity, if someone pays up through February 29th, it will not be added in the newspaper.
Right, yeah. The list that I prepare will be March 1st that morning.
For the 19th print.
Yes.
Perfect, thank you.
Okay, any other questions? Questions or comments? There being none, all in favor of the motion say aye. Aye. Any opposed, like sign. Okay? Thanks, Lynn. Have a good evening now. Let's go to the next item on our appointment schedule. We have our EMS System update with Mr. William Kehler, and we have Adrian with us tonight, so welcome to the boardroom. Good to see you, Mr. Kehler.
Thank you very much. We appreciate the opportunity to present this evening. Appreciate Deputy Director Jones being here. We're here to give you an EMS system update specifically regarding EMS wait times and transfers to Mission Hospital in Asheville. I'd like to review the current staffing matrix for the McDowell system, just so everyone understands. McDowell EMS operates 4 stations, 24/7, 365. And for those watching at home or in our audience tonight, those 4 stations are located on US 221 North, just north of the Hankins Road intersection. Our headquarters located on US 221 South. Our Nebo station, which is a joint project with Nebo Fire Department, and then on US 70 West in Old Fort. We operate 1 ambulance assigned to each of these stations 24/7, staffed with 2 paramedics, 1 EMS supervisor assigned to a paramedic-equipped SUV that oversees EMS operations 24/7. That supervisor is housed at the EMS headquarters. And then we operate a peak truck that runs 9 a.m. to 9 p.m. 7 days a week, and that unit is assigned to headquarters. At peak times, we have 5 ambulances on the road, off peak hours, which is 9 p.m. to 9 a.m. every evening. We have 4 ambulances covering this county. Proper resource management requires close oversight by EMS supervisors, and if they are unavailable, it requires close oversight by the EMS administrators, including my deputy directors and myself, 24/7 to ensure the right resource is available at the right time in the most appropriate location. Tonight we'll give an update on our encounter with the long wait times. Our wait times at Mission really began during COVID as multiple issues plagued the healthcare system, including staffing and an increase in the demand for services. We were very patient and understanding during the pandemic. However, as we emerged from the pandemic, our wait times did not improve, they continued to increase. Increased wait times, also known as ambulance patient offload times, APOT, or also known as wall times, have serious consequences not only for the patient, who EMS is bringing to receive emergency care in the emergency room, but also for the EMS system as a whole. Our crews were commonly waiting up to an hour in multiple cases. They waited for hours to turn their patient over at Mission Hospital in Asheville. Paramedics were being required to treat patients for extended periods of time inside the hospital, utilizing more medical supplies, medications, and oxygen to ensure the patient was cared for to the best of our ability until adequately accepted by Mission staff. When these prolonged delays would occur, EMS districts were being left uncovered for hours at a time, leading to callbacks of administrators, off-duty staff, when 911 volume surged. These incidents also caused long response times to districts that were uncovered. The long wait times at Mission were dangerous for the patient, they were tiring for our EMS crews, and they jeopardized the safety of McDowell County citizens. Deputy Director Jones and I worked diligently for over a year with multiple representatives from Mission and HCA, including the former CEO at McDowell, to bring a resolution to this issue. Sadly, we made no progress during that time, and things continued to get worse. The wait times were initially confined to non-emergency transfers, interfacility transfers originating from McDowell Hospital going to Mission in Asheville, and also included 911 scene calls where the patient requested to go to Mission or their condition required them to be transported to Asheville. In the fall of '23, we began seeing these prolonged wait times occur with patients who were being transported emergently from Mission Hospital McDowell to Mission in Asheville. Just to emphasize, these are patients that had been evaluated by a physician at our local hospital. EMS was called for emergency transfers going to Mission, and we began seeing delays in these patients that were deemed critical. In several interviews and in numerous press stories, I referenced a number of red transfers that are considered emergency transfers. Our longest wait time with an emergency patient going from McDowell to Mission was 2 hours and 44 minutes that our paramedics cared for the patient inside the emergency room before they were accepted. Another incident, 40 minutes, and another 1 hour and 25 for that emergent interfacility. In the interest of public safety, our agency, in close coordination with Mr. Wooten and the board, took unprecedented action and paused non-emergency transfers going from McDowell Hospital to Mission in Asheville until meaningful action was taken to reduce ambulance wait times in Asheville. This action was taken to protect our patients, our paramedics, and our community. During this time, we continued to facilitate emergency transfers between McDowell Hospital and Mission, along with select non-emergent transfers when we could determine Mission had the capacity to accept the patient in a timely manner. We continued to do transfers. We met with HCA leadership on December 19th and extended the pause on non-emergency transfers on December the 20th. During the month of December 2023, we saw a significant change in how Mission receives patients arriving by ambulances in Asheville. Wait times significantly decreased, and that continued in the month of January 2024. Since November 28th, only one patient from McDowell EMS has had a wait time over 30 minutes, and that is a significant reduction from what we were seeing. On January 18th, we lifted the temporary pause and began facilitating all levels of transfers that we received. Since that time, since the middle of December, Mission leadership's been very responsive to our concerns and issues. The level of communication is the best I've seen in years. And we are hopeful that this continues and is sustained in the long term. Our number one objective has been and will always be the health and safety for our patients and the citizens of this county. You task us with the responsibility of ensuring that citizens or visitors who call 911 for emergency care receive the right resource at the right time in the right location, and we deliver that patient to the right facility that can care for them. Our agency has always resolved critical issues through collaboration, open communication, and if needed, taken action that protects the interests of our citizens. We will continue to work with all of our healthcare systems to ensure that our patients and citizens have timely access to emergency care as we continue our long-running tradition of providing world-class emergency care to the citizens and visitors of McDowell County. And just to reiterate, we lifted the transfer pause on January 20th, resuming all transfers if we have adequate resources to facilitate those transfers. To Mission, it's a shared, there's multiple resources that move patients. It is a shared responsibility, if you will. But we lifted that January 20th and have resumed our normal operations since that time. And with that, I'm happy to take any questions.
We, as an alternative, so we've got to the east of us, Blue Ridge and Carolinas, the whole group right there. Is that an option when we had to cease transferring? How does that come into play? What kind of relationship or role do we have with that group?
So let me take this and answer it in two parts. Number one, when someone calls 911 and a patient requests to go to another hospital, we will facilitate that request, number one, if it is within a contiguous county, and number two, if we have adequate resources at that time. What I mean by that is there are times where we have heavy volume to where we have surged multiple off-duty trucks, and we can't facilitate a request of a patient that may want to go to an outlying facility just as a patient request. For 911 scene calls, we will always transport the patient to the most appropriate facility for our critical incidents, including trauma, stroke, heart attack, critical pediatrics, and high-risk OB. Those patients always are moved to the most appropriate facility. For patients entering McDowell Hospital who need transfer, it ultimately is up to that patient as to where they want to be transferred to. We see transfer requests to UNC Blue Ridge and Morganton. We see patients being transferred from McDowell to Spruce Pine. Seldom do we see transfers to Rutherford, but the number one location is Mission and Asheville that we see. However, in the grand scheme of things, the total number of patients that are transferred, and this is something the Deputy Director and I look at each month, we see the breakdown of where these patients go when they leave McDowell Hospital. And they can go as far away as, I think this latest month we've seen Jackson County, Highlands Cashier, Transylvania, the Augusta Burn Center. So there's patients leaving there don't always go to Mission and Asheville. They're various locations.
Is there anything that we could do that would include the Morganton Hospital as a request? I know that, if it comes to a critical situation, you have to get them to the closest possible hospital in order to get the care that they need. I understand that. But in the situation where, I know that what you're saying is that typically you don't go out of county. But the Morganton Hospital being within, I would say, the same distance as Mission, is there anything we could do to make that more accessible?
So we rely primarily on patient request.
Yeah.
And we do see patients request to go to UNC Blue Ridge, just like other facilities. There are times, for an example, if someone has a hip fracture. For many years, we have not had orthopedic coverage at McDowell Hospital. So nearly all of our hip fractures, when we encounter that on the scene in McDowell County, that is an out-of-county transfer. We will leave the scene and go to a hospital that has orthopedic coverage. That's a situation where the paramedics discuss that decision with the patient and their family. And the two choices that we normally hear are Mission or UNC Blue Ridge, which is also known as Chris.
The goal is always to have a positive patient outcome. Can you just tell the board how the addition of the 4 base, now that you're complete, you're set up, that was the vision years ago, how is the new base affecting response time and not being located just right in downtown Marion and having the base on the northern end of town?
Thank you for that question. Consistently, we have seen that move from from downtown Marion to the north station and the south. I refer to them as north on the bypass and south on the bypass. We're able to access the more remote communities, Dysersville, Glenwood, Sugar Hill, Woodlawn, parts of PG, Hankins, the backside of the lake. That has cut our response time to most of those areas right off of the top by at least 5 minutes. When you looked at the time that it took us to get from downtown Marion to the 70 West 221 intersection at Pepperoni's, or the intersection on the south end of the bypass, the pedestrian traffic, the downtown traffic, safety being paramount, it would take us on average 5 minutes to work towards each end of the city here to go to those outlying communities. So we essentially cut that, responding from the corners, and now what we have is we have identified peak times, especially for our downtown areas, to where you'll see a community paramedic floating in some of these higher call volume areas, and that's to ensure that we're maintaining our response time. And I think at the end of the day, what I want folks, our citizens, to know is our decisions are data driven. We are consistently looking at our metrics and in all of our data to make sure that the system is performing at the highest standard based upon the resources we have. And I think our staff does a really good job of that. One other item, just for tidbit of information, I could talk about resource management all day of EMS, because literally you have to get it right. And we have to be right all the time. And if we're not, we've got to learn by our mistakes and figure out what we can do to prevent it. When all of our trucks, some of our folks, we get questions about what does staging mean. People hear that over the radio, or a station reassignment. When all of our trucks, in a prime situation, peak hours, we have 3 trucks working Marion north to south in all the communities in that district. When all 3 of those trucks are out and on calls, we automatically move the Nebo truck to East Court Street about half of the distance. So it's pre-positioned to move north, south, but also still cover the east end. Once we lose that truck's availability, and the only one we have is an Onufrey, it's an automatic staging reassignment, whether it's 2:30 in the morning or 2 o'clock in the afternoon. That truck from Onufrey comes to the exit 81 and stages along the Sugar Hill Road corridor, because we're down to the last ambulance to cover the entire county. So you constantly have them moving back and forth 24/7 to ensure we're in the best position we can be for the next call that comes in.
Okay, comments, questions?
I just want to say one thing, William. When we first started talking about this pause, this board supported you in that decision. I know it was pretty controversial, and it was a point of contention maybe between y'all, us, and HCA. We have seen an improvement. I'm glad to see that improvement. The way that you have always managed emergency management here in the county has been the best in the state as far as we're concerned, and you've been cited as that several times. But we want you to know that we appreciate the professional way that you approach this and the way that you continue to approach it, and we stand behind you 100%.
Well, we appreciate that very much.
3 words I'll highlight real quick. You said data-driven decisions, and that's just the way your crowd operates, and the agency works. So we really appreciate the fact that we've got the best, as Lynn said, no doubt about it. We've got the best in the state. If somebody's like to have a medical emergency, McDowell County is a good place to have it at, because they're going to get top care and top treatment until they get to that facility where they can be treated further. So thank you, William and Adrian, for all you do. We appreciate it. And it's all about our people. We want to make sure our people have the best health care services available. So you're doing a top-notch job.
Thank you very much. Appreciate it.
All right, let's move to the next item on our agenda, under old business, item A, building projects. Mr. Wick, go right ahead, sir.
Yes, sir. A couple of items of note here. You see, I think I said last month that not all the time do you read things in order of importance or what's most paramount to you, but on your memo there, I definitely would agree with your sorting. on the paper. So the first project we'll talk about is the DSS building. Again, for, gosh, maybe 3+ years, you've had discussions about the current facilities that DSS may be found in, which is the main building, the old A&P, what's now the services building, and then the mental health building on the west side of town. And since that time, in order to minimize local expenditures, you have had conversations with our legislative delegation, as I said before, to support that project and that need for a new facility, primarily because of the cost, of course. You've got over 100 employees, lots of space needed, but also you're providing a function on behalf of the state. The state has increased benefit availability, which in many ways is appreciated in the community, but it also is an impact. It's an impact to our staffing, to our facilities, and so there's a need to make room for those folks, whether they're clients or employees. You've authorized the firm Little to prepare some preliminary documents that will be used for some advocacy.
Would that include some type of architectural drawings of a building?
Absolutely.
How in depth would that be?
Probably not entirely in depth where you would look at it and have absolute floor plans.
It's like a preliminary plan.
Preliminary. So there may be, if you remember, Mr. Kehler left, but when there was discussions of his facility, the first plan we ever had for his facility, he drew out. And so that's maybe a lot harder to do with 100 employees. And so we need a little bit of help, and that's what Little is doing. At the end of next week, Ms. Sigmund and I are meeting with the folks to go over, based on inputs that have been put in as far as the number of employees, the clients that we have to serve, the type of setting that employees need to have. Some people need individual offices, some probably could function in a cubicle setting. And so they're bringing back, and it's just very preliminary. It's not final. You get to vote on. You're doing the final. We're not picking paint colors, bush size, anything of that. This is the board's decision.
The reason I said that because I know when Patrick and Lynn were on the school board, when you guys tried to get the state funding for the Old Fort School, the first go around didn't work. But the second time you applied, you had the drawings, you were ready. So
Correct.
To me, the more you can be prepared, when we go to those guys, our legislative delegation, and say, here's what we need.
Correct.
To happen. With drawings, they can see it, it's going to help us.
And last year we had a good story, but not, the drawings and things to go with it. So it should help out. So we'll share those when we get them. And again, this isn't what is going to be at a ribbon cutting, but this will be fully developed out over time, with your input and approval, of course. The next item, Mr. Marsh talked about it. I won't dwell on it so much. The Recreation Center project. Again, the pre-bid is tomorrow. I've also spoken with the architect, as has he, and there seems to be interest from contractors. We always make sure local general contractors that are here are notified of projects. We always encourage them to bid on anything we're doing. It's their choice, of course, but we can't play favorites in that. It's always the low bid, but we do like it when it is a local contractor, and that does happen, of course. And again, we've talked about the last item on this list, and I'll take any questions you might have about any others or anything not listed. But again, talking about the state with DSS, this is another state oversight item with animal shelter, a 1980 facility, and you've directed to do some preliminary planning for that to lead into some fundraising. And so we're just about ready to wrap up some geotechnical work. And then after that is done, your direction will be followed to start a fundraising campaign for that.
Okay, comments or questions by board members to staff?
Before we get off the DSS, has little architect firm been aware of the potential new employees of the DSS because of the Medicare and Medicaid expansion?
They have the.
So that will be included in the plan?
Yes, sir.
Okay, perfect, thank you.
And part of the question and part of their planning typically, and we made sure of that, was you just never know how some of the things outside of our control, like DSS, might be, but the plan for expansion of staffing. And so it might be, space might be for storage or flex space that could be made employee spaces.
And on the footprint of the land, Tony will well know this, being the contractor, that footprint needs to be expandable to do your flex space, but in the event there's a need.
Absolutely. Good point.
Okay, any other comments or questions? There being none, let's move to the next item under old business. This would be water system projects. Mr. Wood, go ahead, sir.
Thank you. Again, several months ago, I split our work into two sections. For right now, when we've set our water system, we've met NEBO, and that's where we have a system currently, and we'll talk about, of course, where that's going in the future. But focusing on NEBO for what we're calling Phase 1, which is 126 Wildlife Road, Lonesome Pine, and others. If you've had the occasion to go towards the state park recently, near the golf course, any of that area, you will see erosion matting. You might see some fire hydrants. You maybe shouldn't see them. They should be covered right now, but because they're not active. But the 126 line is almost done, and it'll go from the Wildlife Road intersection to the old Hendricks Farm and stop. Lonesome Pine has been done for a couple of weeks, and done what in my context is meaning the main line. So we haven't gone back in and done the taps yet with the meter boxes on 126. It's been done on Lonesome Pine. The next road there should be construction is Bentwood Drive, and then the other roads there on Phase 1 will be underway. I have mentioned in some communication, our contractor is having some supply issues with some of the fittings, which are the meter setters themselves, which are made of brass. And so it's probably going to be a situation where the contractor does all of the ductile iron pipe, the hydrants, and everything else. And hopefully by the time they've done all of the mainline work, the setters are in hand and they can go back and do the actual taps themselves. So I haven't been told that they're requesting any change orders on termination dates, which are scheduled for this summer. So hopefully that time frame will still work out for both Phase 1A and 1B. Hoppy Tom Hollows is a grant-funded project that grant we received about a year and a half ago. Been working since then on the design. As I've mentioned, the grant will pay for this one, will pay for the plumbing. Not for the first set of roads, but on this one it will pay for plumbing. And so we have letters more or less ready to go. We're meeting with the engineer hopefully this week to nail that down. And I will take a breather here. There is a resolution in your packet related to the grant. If you could approve that, would be appreciated.
Okay, what's the pleasure of the board?
Motion to approve.
Second.
Discussion. All in favor say aye. Opposed, like sign.
Thank you. And then moving on, NEBO, we received end of the last week the encroachment agreement for Phase 2, which is the section moving back towards city limits. We talked about an easement location for the master meter. We're working with that property owner now to finalize that, so appreciate your authority last month. We're working on East End, which is around the golf course. They're doing preliminary approval there, received some communication from the state last week as well. And you've approved the engineering contract for the area around Exit 90, and we're waiting on the state sign off on that as well. So I mentioned NEBO has been our focus since probably 2005, and we're starting to shift going to focus on Nebo and always operate it, but the new work, a lot of it is going to focus southwest of Marion, what was historically called the Providence area, the area around West Marion Elementary. This hasn't, part of the memo hasn't changed that much. Still have the ARC grant of $500,000 in hand. The state budget is $3.88 million that will be applied towards this project. And as you see, as of a week ago, when the memo was prepared, we had not received the letter of intent to fund.
That letter of intent to fund, so when we get that, the next step would be to go ahead and seek
Engineering.
Okay.
Two of you gentlemen were at a meeting last Tuesday where someone from the state said the letter was outbound that day, and I still have yet to receive it. So I know they're really busy, but we're eager. So I still don't have it.
Make a motion for staff to follow up.
Okay, a motion for staff to follow up. Okay, second discussion. All in favor say aye.
Aye.
Any opposed, like sign. Okay.
Thank you.
Mr. Wooten, let me
sir.
just ask a question. If I understand correctly, back when we were extending water lines out toward Walmart, we did extend out near Pilot?
Yes, sir. There was a lot of foresight with that,
Yes.
thankfully. So it did extend underneath the interstate and right beyond Pilot. The city provides the water to Pilot, and they have indicated that a master meter could be placed there, and the county would then pick up beyond that. So thankfully, that work happened.
I mentioned that
10
simply
years ago.
because that is a huge expense that we would not have to incur now.
Absolutely. Thankfully, it's been done. I believe that's all I had on water.
Do want to highlight though, again, we said it since they agreed to do it, but the Board of Education did go ahead and vote to allocate $500,000 to be spread out over a couple-year period to help get the water line to the school. So here again, we want to say thank you to the school board for their partnership and collaboration in that. Okay, let's go to our next item. This will be item C under old business. This is a broadband update. Mr. Wooten, go ahead, sir.
Thank you. I really hoped for tonight to have the news that we're out the bid on the completing access to broadband grant, but we're not. I've been told a couple of times that we're just that close. We're in the next set of counties to have our opportunity advertised. As I mentioned, I believe last month, the way that process is going to work is the state is doing the bidding on the county, all the counties' behalf. The non-served addresses are in the state mapping program, and so the vendors should be able to look at the map and say, I can serve this area, I can't serve this one, I can serve this one within budget, etc. And so there's not a lot of work on our part except for when the letters of interest are sent into the state, the applications essentially. The county and the state, primarily the county based on numerous factors, will be the entity selecting the best bid. So it's a little bit of an RFQ in that you're looking for the most qualified, more so than the lowest bidder, because it's like a reverse. We're looking for the most households served as opposed to cheapest. I have heard from Charter Spectrum that they have interest in applying. I mentioned I had a conversation with Frontier last week. We've had a lot of history with Frontier, and Mr. Kehler, if he were still here, could give you a lot of history. And the most of the issues we've had with them have been with their copper system being essentially ineffectual. And so what they're doing in the future and here on out is fiber. So the state is doing the pre-screening for these vendors. They have pre-screened and approved Charter Spectrum, and they have pre-screened and approved Frontier. Interestingly enough, Optimum, which is in the county, was not, based on a list, approved to submit on CAB. So if any of the existing incumbent companies do apply, it would not be Optimum.
If you have any old, if you have any of the old landlines with Frontier, you're probably gonna lose them.
It seems like they would like to get people off of that, maybe voluntarily or otherwise. They're required right now through the federal Universal Service Fund to provide it to every address, but just barely hanging on. So there's a couple of other programs, including Stopgap, that will come in after CAB. It will be a state-funded program. I did meet with Foothills Regional Commission staff Friday on the Broadband Equity Access Development BEAD program, which is another federal funding program. It's very similar to CAB in that it's a three-party funding setup: local, state, and which is federal, and the company. And so my charge to the FRC staff at that point, which they've heard it from the other counties they've met with, is to try to find other sources to meet that local match, if at all possible, like Appalachian Regional Commission, like Dogwood Health Trust, someone else that maybe can help out. So Dogwood has expressed interest in providing broadband funding, and this might be where maybe they could come into play.
So as a result, then, with all the different programs out there, the goal would be to have predominantly every household in McDowell County access?
It's always going to be the goal,
will never
100%. But
What's the percentage of that happening? What are they saying? What are they telling?
right now, after all the grants, about 2,700 will be unserved, which is, I think, roughly about 15% of the households in the county. So it doesn't sound like a lot, but when you're not served, that is a lot. So that the goal is always to get to 100%. And the good is that if you're out there unserved right now, you have a lot of people with you, and so it's not just an isolated, well, there's 4 households. There's a lot, and so that means that the companies, there is economic incentive if they're provided assistance from our tax dollars, federal tax dollars, to do so, which is why the companies are moving now, and they wouldn't before if it was strictly shareholder dollars. And so there is more incentive for the companies to move in these areas because there are quite a few. And there might be a few places where they still can't get them, and that's where Stopgap comes in, even after all of them. So there are other resources, alternative satellites and cell phones, but the goal is to get wired service to every household as much as possible.
You know, we're living in a day and time where that's, to me, is as important as a utility. I mean, water, power.
It is.
You got to have it.
Well, you know, we've talked about this ever since my first term on the board, early in my first term. And I learned real quick that we can do everything we can do as far as getting grants and trying to help build infrastructure and all of that. But if the utility companies don't want to go, there's not a whole lot we can do to force them to do that. So my recommendation would be that if our citizens are unserved at this point, that they get on the telephone and they start calling the utility commission and calling these utility companies and telling them we want it.
And let's remind the public, on our effort, we did set aside $1 million to be spent on that project. So we certainly want the public to be aware of that. There's going to be areas that's not going to. I live in an area that won't get it, you know, unfortunately. But there's some of us that won't. But can we mention some of the areas that they definitely say they're going to?
Right, I would categorize as far as the unserved areas, and I have to be clear, there are areas that do not have service as of today, February 12th, 2024, that are scheduled to have service by the end of next calendar year, 25. And so I'm not including in that 2,700 number those households. So the current number is higher, but Charter Spectrum has RDOF, and they have great acronyms there that are two programs that are doing work in the community that are bringing that number down to roughly 2,700. But primarily the unserved areas are around Crooked Creek, they're in North Cove, and they're Dyersville area, Rocky Pass in that area. So, and again, some of the main road areas are served, but once you get even a little bit off, they're not. And so that's where the companies, they can see those little red dots too. And so thankfully the state's doing a great job mapping the deficits, and they'll know where they can focus. And if they don't know, we're definitely saying, look at the map, because it's very clear.
Okay, any other comments or questions? There being none, let's go to new business, item A, Universal Building Lease Renewal. Mr. Wooten, go ahead, sir.
Thank you. Again, the county, since 2012, has owned the Universal building down at the end of College Drive near the college campus. There's 50,000 square foot of training space there, but the balance, apart from the emergency services warehouse, is rented to private companies, and that private revenue is put into the property for maintenance and for other purposes to sustain it. One of the spaces that we have is a hair under 40,000 square feet. It's a warehouse. It's been leased for 3 years. It's been Aria Solutions, which used to be Collins and Aikman. The prior rate was $1.80 square foot. Recommended is $1.85. It's not a very large increase, but it's a very rough space, and they're a good paying tenant, and it keeps it full and it keeps revenue coming into that fund.
Make a motion to accept the lease agreement as proposed.
Motion, second. Discussion, all in favor say aye. Aye. Any opposed, like sign. Okay, let's go to item B under new business. This will be the Telecommunication Tower Ordinance Revision.
Thank you. I'll be clear, this is essentially like a first reading. So not looking for action tonight other than to perhaps agree to have a hearing next month. A while ago, you approved a revision to our telecommunications tower or cell tower ordinance to allow for a maximum height of 199 feet. What has since been determined is that federal law allows companies to essentially say, well, that's great, but we're going to go 10% above that if we want to. They have to demonstrate a need, but essentially they have that right. And so we're, planning staff and the board are essentially asking to back up on that revision and bring it back to 179 feet. And so if there is a request, it would still be roughly around that 200 feet. So if you're agreeable to that, we'll have a hearing next month and receive comment and then perhaps approve a revision.
Okay. Yeah. By consensus, the board says move on with it. Okay.
Well, you know, if it's essentially going to provide better service, you know, I don't think it would affect anyone that much.
Okay. Let's go to item C under new business. This will be the budget update. Mr. Wooten, go ahead, sir.
Thank you. Again, in this, I focus on the current fiscal year. So you see the property tax collection provided by the tax collector, your sales tax report, and then there's some action items. American Rescue Plan Amendment 11. There's a project budget ordinance for the Foothills NC Home Consortium project, and then budget amendments 20 through 24.
Move we approve the budget items as presented.
Second.
Discussion. All in favor say aye. Aye. Any opposed, like sign.
And I will mention very briefly, just for update, we are on the cusp of starting the fiscal year 25 budget process. So internal and external departments and agencies will be receiving their letter within the next week or so, and we'll start that process. So I'll more than likely report on that next month, and we'll be setting a schedule and presentation dates and that sort of thing.
Okay, let's go down to D under new business. This would be the administrative items. Mr. Wood, go ahead.
Thank you. The first item we intended to address at your last meeting with the DSS director, but I think we ran long, so we just held it. In the child welfare section, you have social workers, of course, through various levels, trainee 1 through 3. You have investigators and everyone, foster care workers, everyone's important. Very important as well are what we call CSSTs, and these are staff members that they will drive children to appointments, they will facilitate visitation with birth parents. And when we had a vacancy come up, when Ms. Sigmund was looking at this, she realized that we actually had it coded erroneously. We need to, based on a requirement to have an associates for that position, it should be a grade 63 instead of 61, which would increase the pay for the current staff, but also for future staff, it would cause that to be advertised at a higher level. And so we're asking for that to be approved for that upgrade.
Move that we approve that request.
So,
Discussion? All in favor say aye. Aye. Opposed, like sign. Okay.
And the next item, and I could package these together if you would like to do that. Okay, you have EMS write-offs. These are related to what Mr. Kehler was talking about. On a related note, we typically ask for an adjustment on EMS transport rates every year once the Medicare rates are adjusted. So there's kind of a two-part ask there. One, to allow the fee increase, but also to maybe make it automatic every year based on whatever Medicare increases that we follow the rate. The next item, talked about the home consortium a bit ago. This is the multi-county and multi-municipality agreement that we have with our partners to operate the home consortium. This is federal funding that is being brought to the community for housing upgrades, housing assistance, and so forth. So this is a revised agreement we have to approve every year. We have vehicle financing. You've approved the purchase of these vehicles, and we have the financing now for an ambulance, 2 DSS vehicles, and 1 F-150 for recreation. And then the last item, the committee for the Trails and Trains Festival has asked for another annual contribution for that festival, which will be held June 1st. There was a request made and approved last year, I think of the same amount of $4,000.
Okay, comments or questions?
I'll make a motion to accept the administrative items as presented.
second.
Discussion? All in favor say aye. Aye. Any opposed, like sign. Okay. Let's go to board appointments. Item E.
I'll cover these. We have second readings tonight. We do not have applications for these. With the clerk changeover with Miss Allison, we're asking for 1 more month to take in some applications for these boards.
Motion
just
to
to
allow it.
give some time.
Okay, do you have a second?
Second.
Discussion? All in favor say aye.
Aye.
Okay. Any opposed, like sign. Go to item F, tax matters.
These are your typical releases, refunds, and rebills.
Okay, what's the pleasure of the board?
Move we accept the tax matters.
Second.
Discussion? All in favor say aye. Aye. Any opposed, like sign. Okay, let's go to the next item on our agenda for tonight. This is citizen comment. Our attorney has a list, so Mr. Coach, if you could bring that to the clerk. All right, this time we have commissioners and staff reports. Do we have anything from commissioners or staff?
Just a reminder, you meet next week for your back on third Monday schedule. with Ms. Sigmund and others.
Okay, all right. Next item on the agenda will be a closed session for personnel matters. So pursuant to General Statute 143-318, 11A6, we need a
Mr.
vote.
Chairman, I make a motion to go into closed session.
A vote, second discussion. All in favor, say aye.
Aye.
Okay.
Mr. Chairman, I'd make a motion to come out of closed session.
Second.
Discussion, all in favor, say aye.
Aye.
Any opposed, like sign. No action was taken, so do I hear a motion, we go ahead and adjourn?
So moved.
Second.
Discussion, all in favor, say aye.
Aye.
Meeting adjourned.